the COVID-19 pandemic emerged as one of the most significant global crises in modern history. It began innocuously enough in December 2019, when reports surfaced from Wuhan, China, about a novel coronavirus causing severe respiratory illnesses. Initial cases were attributed to a seafood market, sparking concerns about zoonotic transmission. As the virus spread more rapidly than anyone expected, Wuhan became the epicenter of a global health emergency. Authorities eventually enacted a historic lockdown, quarantining millions in an effort to contain the outbreak. By early 2020, the virus had breached national borders, aided by international travel. Italy experienced one of the earliest and most severe outbreaks outside China, leading to nationwide lockdowns and extensive healthcare strain. As COVID-19 cases surged across Europe, Asia, and North America, governments faced the daunting task of balancing public health with economic stability. Countries like Spain and the UK saw their healthcare systems pushed to the brink, while news outlets shared images of overwhelmed hospitals and makeshift morgues. In the US, New York City quickly became a hotspot, and similar scenes of overrun healthcare facilities played out. Global lockdowns were implemented, varying in strictness from country to country, putting a halt to normal life. Streets in cities once bustling with life lay deserted. Daily scenes in New Delhi, Paris, and Tokyo changed radically as citizens adapted to new realities: mask mandates, social distancing, and quarantine measures. Economies reeled from the impact, and unemployment surged, highlighting the socio-economic disparities across different populations. Meanwhile, the urgency for medical solutions became paramount. Scientists worldwide embarked on an unprecedented collaborative effort to develop treatments and vaccines. Throughout 2020, promising news of vaccine development brought a glimmer of hope. Pfizer-BioNTech and Moderna were among the first to produce vaccines using mRNA technology, showcasing scientific ingenuity. By December, vaccinations began in earnest, starting with frontline healthcare workers and vulnerable populations. This monumental achievement underscored the tireless work of medical professionals and researchers. Yet the challenges were far from over. Vaccine distribution presented logistical nightmares and ethical considerations regarding equitable access. The pandemic had laid bare the vulnerabilities in global health systems, but also highlighted the unyielding resilience of humanity. From the courageous efforts of healthcare workers to the community initiatives aiding the most affected, the response to COVID-19 showcased both the fragility and strength of our interconnected world.